there are potentially modifiable risk factors for dementia, it has been calculated that if you modify these 12 risk factors, you might be able to prevent or delay up to 40% of dementias. What is pretty clear from the data is that the social determinants of health play quite an important role. The question how much education you get, how much income you have, inequality is an important factor, and also how many social contacts you have. So if we want to prevent or delay dementia, if we want to modify the risk factors, we do need both approaches. We need population-based public health approaches, and we need individually focused prevention. Individually focused would be, for example, that you treat hearing loss early on, hypertension, obesity, diabetes, and so on. I will talk today more about the implications of these population-based interventions, so public health interventions to improve risk factors. And I think if you consider the multiple effects that those interventions have, they have implications on well-being, on the autonomy, and on equity, on equality. So they have ethical implications, and I think that's a good reason for a systematic assessment of the ethical implications of these preventive interventions. And I would like to present you very briefly, and you will receive the slides because I believe they're pretty fast going through this. And I also am ready to share you the publication that should be based on a systematic approach of public health ethics. So what's the goal of public health ethics? And I think we have three different goals. The first is really to identify ethical issues in the field of public health, and then ethically evaluate individual public health interventions. And this is especially important, develop ethically justified recommendations for the development and implementation of public health interventions. So ethics really plays a constructive role, or shall play a constructive role in shaping the design and use of public health interventions. If this is the goal, what do you need to achieve this goal in a systematic way? You need a comprehensive and flexible normative framework. That means an explicit ethical justification. What are the normative criteria you apply to a certain preventive intervention? And the second is that you then need a systematic methodological approach by which you apply this normative framework to a certain specific public health strategy or public health intervention. This guarantees a transparent evaluation. So people who want to understand how did these results come about, they can really follow step by step the evaluation. It's good for the process quality assessment, and it helps to educate and guide public health professionals in applying ethical requirements in their practice. Don't be intimidated by this table. I will present it again with a focus on dementia prevention. These are the normative criteria which we have collected for the ethical evaluation of public health interventions. On the right column, and you see the respective ethical justification. And there are 6 criteria which we have to apply. The first is the expected health benefits for the target population. Second are potential harm and burdens for the participants. A third is impact on autonomy of the people. Fourth would be impact on equity. And fifth would be the expected efficiency and the legitimacy of the public health program. I will share the slides so you can go over the all the detailed points on your own afterwards. So now we have the ethical criteria which we have to apply, and this is the suggestion for a systematic approach, step by step. You have to start with a thorough description of the public health intervention. What are the goals, the methods, what's the target population, and so on. So you really understand what the need of the target population is and what kind of intervention is developed. The second step would be that you go over the criteria again and look whether they have to be specified for this specific public health intervention, because this framework should be flexible and should be adapted to specific contexts. For example, if you use digital technology, then you have further issues of responsibility, of data security, data protection, and so on. Then you would start with a step-by-step evaluation. So you apply each of the criteria to the public health intervention, which I will do in a second with dementia prevention. And then the fourth step, you have to bring these separate evaluations together to an overall evaluation of the public health intervention. And there you have to balance competing ethical consideration if this is the case. And the fifth would be that you develop recommendations based on this synthesis of findings for the design, implementation, or modification of the public health intervention. And the sixth step would be a monitoring. So after the public health intervention has been implemented, you monitor how the ethical implications develop, because it is sometimes not so easy to anticipate what the ethical implications will be. Now let's have a closer look how this ethical framework could be applied to dementia risk reduction prevention in the field of dementia. If we apply the first criterion, the expected health benefits for the target population, we have to require that the assessment is valid of dementia risk factors, because we want to reduce these risk factors. So in the first place, we must have good data as what are relevant risk factors. Then in the second point, we should have some data about the effectiveness, that if you use certain strategies of prevention, that they are really able to prevent or delay dementia. And you should design communication strategies to improve adherence to effective lifestyle interventions. So this is a requirement to increase the expected health benefit, because you all know that effective prevention of dementia requires lifestyle changes, and it's very difficult to bring about lifestyle changes. You have to increase the motivation of the people so that they're really able and willing, or willing and able to change their lifestyles. The second would be that you look, well, what are the potential harms and burdens for the participants in this dementia prevention intervention? I think especially important would be to minimize psychological harm that may be caused because people now fear that they get dementia, and they may be actually compromised in their psychological well-being. And this should be minimized by understandable, careful, and empathetic risk communication tailored to the specific target group, so that it's understandable and that you really tailor the information to the individuals in that group. And you should minimize burden by tailoring risk prevention strategies to the living conditions of the target population. If they are overburdensome, then it will be difficult to achieve the goals of the preventive program. The third evaluation criteria would be impact on autonomy. It should be the goal of the program to improve the general health literacy as a basis for a healthier lifestyle. If you have a look at the risk factors for dementia, most of them, they are not specific for dementia, but if you have a positive impact on these risk factors, you will also have less obesity, you will have less cardiovascular diseases, and so on. So I think it's really important to generally improve the health literacy, and focus should be the health-related empowerment through evidence-based, balanced communication about dementia risk reduction. And you should support self-determined behavioral life changes. And that's another interesting ethical issue, how far nudging could be an instrument to help people lead a healthier lifestyle. So these are all requirements that try to strengthen autonomy and not decrease autonomy and say, well, you have to behave in this way, and then your risk for dementia will be decreased, but it should be via increasing autonomy. Impact on equity is especially important, as you see that disadvantaged groups have a higher risk for dementia. So dementia prevention should be targeted to disadvantaged, vulnerable groups with lower socioeconomic status and thereby higher risk of dementia. So there should be priority to the worst off, and overall we should try to reduce the inequality, and this will then have a positive impact in terms of risk reduction. We should secure individuals equal access to dementia prevention. So if we have identified the high-risk group, then each of the individuals should have equal access. Expected efficiency is probably not a major issue, but still it would be good to have cost effectiveness data for different preventive strategies. And if you have a defined 2 strategies, to achieve a certain public health goal, that means a certain level of dementia risk reduction, of course, you should use the most efficient strategy to achieve this goal. And the last point would be that the prevention program established by legitimate public health authorities, and among these criteria for legitimacy, participation of the target groups in the design and implementation of the prevention program, I think is especially important, especially if you go back to these points that really require that the strategy of risk reduction is really tailored to the individual characteristics and individual needs and possibilities of the target group. I close with a brief conclusion. The public health ethics framework I proposed here in brief, sorry again for this short presentation. It provides a methodological approach for assessing ethical implications of dementia prevention. It requires, and that's really important, close cooperation with empirical sciences, and both the public health sciences that deliver us information about the effectiveness and harm potential of interventions, and of course, very important with the socio-cultural sciences. And so we really need a multidisciplinary approach, as it is realized nicely in this meeting. And again, the goal of the structured ethical assessment should be to shape the design and the implementation of dementia prevention according to ethical principles. So I really would like to stress this constructive and practice-oriented approach to public health ethics. Thank you very much for your attention.